Vomiting in pregnancy is a very common symptom. This is especially experienced by women in the first 3 months of pregnancy. The severity of vomitings and the frequency of vomitings varies from one person to another. It even varies from one pregnancy to another pregnancy in the same woman. For some women, it is only in the morning as soon as they wake up when they brush their teeth, and then they're fine for the rest of the day. For some other women, it is mainly in the evening times. But for some women, it can last throughout the day. There is altered sensation in the tongue. They're not able to taste most foods normally. They are unable to tolerate the smell of food and sometimes even the sight of food. For some women, the vomiting can be so severe that they're not even able to tolerate water. If you experience this symptom, it is very important that you discuss this with your gynecologist. Your gynecologist will assess the severity of your vomitings and give you medications accordingly. There are several medications which are very safe to use in pregnancy, and they will not affect you, your baby, or your pregnancy in any adverse way. So with these medications, if you are able to tolerate food and water, that is good. There are some situations where, in spite of having oral medications, you are not able to tolerate food or water. In such situations, you might need admission to the hospital, where you will be given intravenous medications to control your vomiting, and you will be given fluids to maintain your hydration. Generally, after a short period of these intravenous medications, you do tend to feel better, and you will be able to go home and you will be able to feel better with oral medications to stop your symptoms. Even if you're not able to eat a lot because of this vomiting, it is important that you at least try and have small nibbles throughout the day and try and have some amount of carbohydrate intake. It's also important that you try and keep yourself well hydrated. This can be with water, juice, glucose drinks, ORS, or any form of non-caffeinated and non-frizzy drinks. So no coffee, no tea, and no colas. Any other form of liquid to keep you hydrated would be good. It's also important to note that these symptoms generally tend to settle after the first 3 months for most women. There are some cases where the vomiting can last throughout the pregnancy, but for most women it tends to settle after the first 3 months.